Good afternoon. My name is Haley Bell. I'm a training program manager with Telehealth ROCKS, and I get to facilitate today's session. So we're super excited to have you guys here for the sixth session of our new Echo Light training series, supporting the whole child, connecting brain health systems in practice. So super excited to get to introduce our two speakers today. First, we have Ryan Smith. Dr. Smith is an associate professor in the Department of Pediatrics at the University of Kansas Medical Center. He serves as the medical director of informatics for the department, as well as founder and director of the Pillars Medical Complexity Clinic at the University of Kansas Health System. Dr. Smith received his medical degree from the University of Kansas in 2010 and completed categorical residency in peds at the University of Minnesota in 2013. He also secured board certification in clinical informatics by the Practice Pathway in 2017. So super excited to have Ryan join us here today. We're also joined by Deb Cook. Deb is a registered nurse and certified asthma educator with 43 years of nursing experience. She retired from the Kennett Public Schools in Missouri after serving for 29 years as their director of health services. Throughout her career, Deb's been actively involved in school nursing leadership at both state and national levels. She's also served in numerous roles within the Missouri Association of School Nurses, including the president role, as well as being a member of the board of directors for the National Association of School Nurses. Deb also serves as a hub team member for the Show Me Echo asthma program and previously served on the hub team for the Trauma Informed School Echo program. So we're super excited to have both Deb and Ryan join us for today's session.
Thanks so much, and I appreciate the introduction. I'm so happy to be able to share this educational session with Deb. Some of these slides are taken from previous Telehealth ROCKS Echo sessions that we had around medical complexity, and some of the slides have our partners cited, Dr. Emily Goodwin with Children's Mercy and Dr. Dana Bacula also with Children's Mercy. So when we think of medical complexity and children with special healthcare needs, we need to kind of start with what defines that population. First of all, it's much greater than I think most people appreciate. About 20% of U.S. children have special healthcare needs, have medical complexity. We can see a definition right there. And the important thing is that there's different components. There can be social complexity, emotional complexity. I think people are very kind of anchored in developmental kind of physical abilities, with cerebral palsy being one of those things that really immediately jumps out to people when they think about medical complexity. But it can take different shapes. I think that's a really important thing to realize. And like when we have patients that have greater complexity, they have more needs, like having a systemic way that we approach problems and understanding that each young person is a little bit different in some of the challenges that they may have. Next slide. This is kind of a visual representation of what was on the last slides, but I think it's a good kind of call out for children with medical complexities, the different domains that we have to really focus in on. So understanding functional limitations and how those affect a child in their daily life, how that affects them getting around and participate in different school activities, their healthcare use, and actual risk for events at school and out in the community. So what types of events have happened in the past, and how can that inform what we're going to do in the future? What is the full breadth of problems that they have or chronic conditions? And then what are those needs that the patient, the young person has in the healthcare setting, the community setting, but then also with us in the school-based setting. So next slide. One of those things that I think gives even our medical students and pediatric residency trainees some pause is the different assistive technology that our patients may leverage to function appropriately. This large blanket of assistive technology. And sometimes it'll be getting to some basic core functions, breathing, circulating, stooling. Sometimes it'll help a child get around. Sometimes it'll help them communicate. I think um, for as much as I struggle with tablets in school, having 7-year-old children, tablets and communication devices have really gone a long way in allowing medical complex, functionally limited children to communicate appropriately. And so there's a breadth of different technology that these children may have. And as we get more familiar with it, as we build partnerships between our school-based, community-based, and healthcare-based partners, I think we can be a lot less intimidated about some of this technology. Next slide. When we think about medical interventions, medication administration is one of those that is important to call out. A good portion of the patients that I see will get medications 2, 3, 4 times a day. And so that leaves them at least getting med administrations once or twice each day. And I think the important thing is that there's been a lot of investment in the pharmaceutical industry to support effective means of administration. Realize some kids can swallow pills and that's an easy thing to do, but understanding there's other ways to get medicines into the system, especially in emergency situations, things like sublinguals, injectors, nasal sprays. All those are alternative ways to provide medications that can be really helpful in the case of medical emergencies. But there's lots of different ways that we get meds in right now, which wasn't the case, I think, a generation ago. And I guess people can put it in the chat. I'm kind of curious to know how many people have heard of emergency information forms, if they actually seen emergency information forms. These take a few different shapes depending on the clinical care setting, depending on um, who's seeing the child, but the AP, the American Academy of Pediatrics, has a form for children with medical complexity that should be exhaustive for patients with medical complexity, that will provide a list of all the problems that the patient may have, meds, allergies, other kind of extremely critical information, and then a series of kind of if-then type scenarios where if the patient has intractable seizures for more than 5 minutes, in which the patient turns blue, becomes limp, then you do X. If the patient starts to vomit uncontrollably while taking a feed, we stop the feeds, we wait. So this is where it can be so helpful to understand what's happening in school, hearing that from the patient, the caregiver, from the school team, so that we can kind of get that if and then build out a then to make sure that these things that are common, that kind of routinely happen, don't become a big surprise. Contact information, I think, is really important too. So understanding who's the medical team, who's in charge of what problem, who we contact when a child is having a particular issue. And then there's this concept of a go bag. So all of the core medical equipment that a patient may need in the case of a medical emergency. Do they have their seizure rescue medicines? Do they have their muscle relaxers, their anxiety medicines to calm them down? But the go bag is kind of one of those things. The replacement of a G tube or a Foley plastic catheter to put in a gastrostomy kind of opening in the stomach if a tube falls out. So that go bag should have all the medical equipment, and then the emergency form should have all the content and information that you need to kind of troubleshoot through expected uh, and or like previously occurred issues. Next slide. And so that emergency information form a lot of times will be very exhaustive. That's kind of paired with this other idea of action plans. And I'm sure Deb could give us a lot of discussion about the asthma action plan. That's the one that kind of was first broadly used in clinical practice. And then all these other conditions kind of latched on. I've seen seizure action plans, hypoglycemia and hyperglycemia action plans, constipation action plans. Pulmonary action plan is like if you have someone with a trach or just chronic issues with breathing, how to suction out, how to clear, how to intervene when needed. And these are just some of these other type things that uh, you may have a dedicated action plan outside of emergency information form, that kind of exhaustive form. And again, understanding that like concept for this is where a patient normally is, this is where some of the mild problems that we may encounter, and this is what we do, versus like in real emergencies, this is how we act, this is how we intervene appropriately.
Well, thank you, Dr. Smith, and thanks to Telehealth Rocks for having me involved in this. I am a person who is always excited to share information about school nursing. As she mentioned, I'd been the Director of Health Services for 29 years, and I never intended to stay that long, I promise you, but I loved school nursing and working with kids. Next slide. So I'm going to go through these slides kind of quickly and just the introduction. I'm just going to talk about the importance of supporting students with complex health conditions. And I want to just point out, we talk about complex health conditions, and some of the things I'm talking about today, some of the students, we typically refer to as chronic health conditions. Complex health conditions are usually those that are more involved and require more care, but we do want to think about all students. And they, to a parent, they may consider their child with asthma to be a complex health condition. It all depends on the severity and what's involved. But complex health conditions, chronic health conditions, all can impact the attendance and academic performance and participation. And therefore the overall well-being of the child. It can just impact their whole life. So we really want to take a role of advocacy here to make sure we provide what's needed. So we're going to talk today about the role of the school nurses care coordinator. I noticed there's not many school nurses on the call, and I'm kind of glad because I think it's important for others to learn about what is the role of the school nurse for the child, or what all is involved in the child with complex health conditions. Next slide. So, understanding complex medical conditions, as I said, we're talking about complex and chronic. It can involve any of these. I'm not going to read them for time's sake, but just, take note. There's a lot of things, and there's several things that aren't listed here. Dr. Smith mentioned constipation, and you have encopresis, and there's just so many things. So many children with complex medical conditions end up with other issues, such as constipation, breathing issues. Next slide. And so Dr. Smith also talked about building the school health team. I think it's important to note the school health team may encompass others. You have community partners. So like in my school district, we didn't have a full-time physical therapist or occupational therapist. So we contracted companies to come in or specialists to come in and work with us on that. So the school health team can be very large, as he mentioned, or it can be a small team. And typically, you want to think about the school nurse as being the leader of that team, but not always. Like you have special education directors, sometimes they're in charge of it because the child does fall under SPED with having an IEP or a 504. So it's that we're a team and we all work together. And the school nurse's role may be that of making sure that you think about the communication, and the school nurse's role is there as the advocate to explain what the condition is, what it involves, and also, for example, like making sure they're meeting the needs. And sometimes it would just be as simple as discussing, like sometimes the teacher at the beginning of the year would be getting a complex medical student and she'd just be like, oh, I can't deal with that in my classroom. There's no way I can do this. Like on and on. And then when you start talking to her and educating her and providing resources, she understands it is doable. And typically it ends up that they enjoyed having the student, they learned a lot. It was a challenge, yes, but also it was so rewarding that they were able to help it. So the school nurse's role is building that team and the enthusiasm and reminding everybody why we're there. It's for the kids and helping them. Next slide. So we have to start out of thinking about what are the needs. Reviewing, as they mentioned, the information, emergency information that the parent fills out at enrollment. And when a child has a health concern or a health need, complex medical condition, think about that. Put that card in an additional pile and then think about it. What are the challenges going to be? What are the needs going to be? What is the child's knowledge of their condition? What is the parent's understanding of their condition? And a lot of times that's where we become the educator. The school nurse has to educate the parent about how to help the child and make things better, getting the parental consent and releases. And I think this is, very important to begin with, to make sure you have all of those. And the more we can communicate, the better. And then I mentioned about the health status, the child understanding, the parent understanding. What are the potential barriers to learning? Okay, so if that child has physical therapy so much time and speech therapy, and they've got to be gone every Wednesday for oncology for an infusion appointment, how many things and how much time are they out of the classroom, and how do we work around those barriers? How do we, if the child's riding a bus to school, how do we make sure they have the equipment they need at school and home? How do we make sure that they have a set of books maybe at home and one at school so they're not having to carry them back and forth? And then the emergency concerns. And I love that everybody was interested in the emergency information form because that makes so much sense. Like I think about that being the communication tool between all of us. And it's like, here's our go-to. Like if something's happening, let's go to our emergency information form. And this is where we can also plan from. Next slide. Planning care, coordinate the meetings, parent, teacher, administration. And in my years, I never found a teacher that was excited when I went to them and said, we need to plan a meeting. They all felt like they were meeting out, and I understand because they were. But it's very important to have those meetings, those discussions, have the right people at the table to discuss and figure out what's needed. A lot of times before the IEP meeting happened, I might go and meet with the teacher, meet with the personal aide that was helping the child, might meet with the administrator, the SPED director. I would try to make sure I educated myself on the challenges of that child. Say you have a child with a condition that affects their hearing and they have a hearing aid, and I want to know, okay, who's checking the hearing aid every day to make sure it works correctly? Who's changing the batteries? I mean, there's just so much in that. So the school nurse needs to make sure they gather that information, ask the right questions. I often talk about asking the right questions. And then you have the information when you get to the IEP meeting to discuss this, or the 504 accommodation meeting. Developing emergency plans, and yeah, asthma action plans are a big one. My big thing is about action plans. They are very important. You need emergency action plans, but they need to be doable. They need to be applicable. Like, for example, when I first started in school nursing, I'd come across an asthma action plan that said, if wheezing, give albuterol. If respiratory distress, call 911. Well, that was pretty much all common sense. I want to know exactly what are the steps like. like if they ride a bus, do they need to sit in the front of the bus so that the bus driver can be aware if they're having any difficulty breathing or if they have seizures, or where is the albuterol? And like sometimes it would even say give a nebulizer treatment. Well, I'm like, nobody can do a nebulizer treatment on a bus. Like, we got to think about this. So your emergency action plans need to be usable. And that's when you're looking at them, make sure they're doable, make sure time frames are good and who's going to do what. Like, I think about if you have a cardiac emergency, who's calling the ambulance, who's getting a copy of the demographic information to send with the ambulance, who's going to watch for where the ambulance goes. Those things seem little, but in an emergency, they're big. So it's good to have all the information and practice responses. Your daily management, it may involve the medicines, as Dr. Smith mentioned. Some kids get multiple medications, and I think it's important when you're in those meetings to talk about how do we keep the time out of class to a minimum? Like, what do we do? So we need to be looking at that and think about how do we make this better, talking with the provider, because sometimes the providers don't think about the time out of class and they'll order nebulizer treatments at school twice a day, and you're thinking, okay, if I can teach this child how to use albuterol inhaler effectively with a spacer, that's only like 5 minutes out of the classroom, where a nebulizer is 20 minutes, all depending on the developmental status of the child, the maturity, and if they're able to do it, an inhaler. But that's just some of the things that sometimes parents don't stop and think about. Medications. I want to bring this up, and I'm short on time, but I do want to talk about this. A lot of school districts in Missouri, I haven't looked at Kansas, but a lot of school districts in Missouri, their medication policies will say they give medications if it's required by the IEP or 504. Sometimes medications are needed outside of an IEP or 504. For example, and I keep bringing up asthma, but it's just one I work more with, so I have more examples. But say a student is on a controller twice a day, and they keep on having to use a rescue inhaler at school, and you're talking to the child and they missed their controller dose that morning, and you talk with the parent and they're like, oh yeah, we got busy, I forgot it, or I didn't think they needed it. And you find out that life gets hectic, and I just think my kids were 8 years apart, and I was challenged. Like, I was challenged in the mornings with getting them to school and getting myself to work, and I think if a parent is dealing with multiple things, and maybe their shift starts at 7 a.m. and somebody else is getting the kid ready and getting them to school, there's all kinds of things that can happen. Is it a parent's responsibility to make sure they get their medicine? Absolutely. But if the role of the school nurse can be, oh, we give this controller at school every day in the morning, we may be able to, this child's doing better, can stay in their seat and not have to leave for albuterol throughout the day, and avoid the child having difficulty with their asthma because they're getting it regularly. So just keep that in mind. Like, sometimes we have to go to the gray areas. Always follow your district policies and procedures. I'm not asking you not to, but maybe you need to advocate for changing those. And then supplies, especially with like diabetics or some of the children that Dr. Smith was talking about with catheters and tracheostomy tubes and everything. In those meetings, decide who's responsible for having what there. And sometimes it's just good for the school to have some backup supplies. Funding's tough, it's getting tougher, but just think about talking with the parents or with the insurance. And I also think about this. If a child is on Medicaid, then a lot of times they have a case coordinator, a care coordinator person, and you're having trouble getting the equipment you need at school. Talk with the parent, get permission, consent, but talk with that case coordinator and say, hey, we need some backup supplies here at school. Dr. Smith talked about the emergency go bag. Absolutely. You don't know how important that is, even for the child, the diabetic child. Like, in the event that you have to evacuate the building, you have a lockdown. It doesn't have to be that the child has an emergency, but there's an emergency in the building and something happens. Or there is the fact of, I lost my train of thought real quick, sorry. Field trips, thinking about that, and we'll mention that in a minute. But in those meetings, discuss who's responsible for the supplies, and then Let's have some backup plans. Take advantage of those MCOs, the managed care organizations, or Medicaid. They have a lot of resources, and sometimes we don't even know all the resources they have until you ask the question.